What if hundreds of thousands of Georgians and millions of Americans across our country could see a reduction in the cost of life-saving medications? So that's a question senators continue to debate in Washington, D.C. as the push for a cap on certain expensive medications that could save Americans thousands of dollars. 11 Alive's Hope Ford explains why local patients and doctors are now calling for senators to make health care more affordable.
Bethany Kinsey is one of a kind, but her story is one of millions.
I've had type 1 diabetes for 29 years. I was diagnosed at age 5. It's shaped a lot of my life.
Shaped her life becoming a nurse practitioner to help others with diabetes, but also for the insurance.
Grew up knowing I had to get a job that guaranteed benefits so that I could afford my insulin.
In Georgia, 12% of the population has diabetes. Many don't have insurance, and insulin-dependent diabetics spend an average of $98 per unit of insulin. It's why people like Emory's Dr. Kenneth Thorpe want senators to add provisions lowering insulin prices into their upcoming economic bill.
If you have to pay a lot out of pocket, we know people don't fill their prescriptions, and what happens, they end up getting sick and end up in the hospital.
Some Senate Democrats hope to get a $35 cap on how much people with Medicare or private insurance pay each month for the medicine.
High gas prices, high food prices. We have a real great opportunity here to make medications not only affordable, but hopefully very close to no out-of-pocket payments.
Thorpe and Kinsley say if this happens, it could open the door for lowering the cost of other high-priced medications.
Once you set a precedent, a lot of other insurance companies can follow that precedent.
Senate Democrats are rushing to put in some kind of insulin-related policies, although the clock is ticking down as a vote on the economic bill is expected this week. Living with diabetes is a long-term game. Kinsley believes it's time for a long-term solution.
The cost of insulin impacts so much in someone who has insulin-dependent diabetes. This monthly cost, if we can reduce it, it's going to take pressure off from them.
In Atlanta, Hope Ford, 11 Alive News.
So right now, the current Senate economic bill does have a provision that would allow Medicare to set up an annual cap of $2,000 for out-of-pocket costs. But critics say that's still a fortune for most people.